Thank you, Nikos. Since you were so friendly to do the introduction in English and your presentation in Greek, I will do the reverse. Κυρίες και κύριοι, καλησπέρα σας. Πριν από ένα χρόνο μίλησα από το βήμα αυτού του συνέδριου ως εκπρόσωπος της καινοτόμου φαρμακευτικής βιομηχανίας στην Ελλάδα, αλλά και ως ασθενής που επέζησε χάρη στις καινοτόμες θεραπείες. Τότε ζήτησα τη σύμβολη σας με σκόπο να δημιουργήσουμε μαζί τις συνθήκες βιωσιμότητας για την καινοτομία, ώστε αυτή να είναι τροποσίτη και να μπορεί να καλύφθει από το σύστημα υγείας. Σήμερα θα ήθελα να συνεχίσω αυτή τη συζήτηση, καθώς έχει υπάρξει προόδος, αλλά απαιτείται πολλή δουλειά ακόμα. That's enough for now, eh? Okay, so the way that I've structured this presentation is in a series of statements that I will then talk about a little bit. But the summary of the whole presentation is securing a viable sector to ensure a healthier Greece. And what I want to really talk about is that the two are really connected. You need both. So the first statement is probably the most important one that I've had a lot of conversations about with many stakeholders here in Greece. You need a stable commercial environment, a predictable environment that provides a stable climate attractive for investment. It sounds very logical, but especially in these political uncertain times, it's not a certainty, for sure. We know from other countries that the collaboration between the industry and the government is key if we want to achieve short-term and long-term goals. The industry has a lot of knowledge in doing this with countries across the globe, and we have many examples that we can bring to the table where we can help a country improve its policy-making environment. The other thing is that the pricing and reimbursement processes must be transparent to safeguard manufacturers. And I have to say here that this is the area where we need a lot of improvement. If you look at the most recent example, where the government changed the goalposts, and instead of needing 2/3 of countries to get reimbursement, we now need 18 countries to get reimbursement. That is not really an example of a predictable and transparent environment. So we need improvement there. The second statement is that the pharmaceutical industry strengthens the Greek economy. The pharmaceutical sector is vital for the economy of this country. There's a few characteristics of the industry that I would like to highlight. First of all, the industry really employs a lot of highly skilled people. In fact, Greece is number 5 in the world in terms of the number of highly skilled employees per head of the population. In terms of local production, it's also incredibly important. The pharmaceutical sector is the second biggest export market for Greece. So this is a very important sector. The creation, therefore, of an R&D-friendly environment with the right incentives is key to attract more investments in Greece. We have already seen that the clinical trial investment has gone down from about 80 million in 2010 to about 13 million in 2014. Whereas other countries that are of similar size have hundreds of millions of dollars of investment because they had a strategic plan to attract these investments. So creating collaborations is important. Collaborations between the private and the public sector, also partnerships between multinationals and local companies, and also collaboration between companies and local research institutes. I recently had a discussion with the Dean of the Athens University about the fact that we should really make Athens a center of excellence for medical research. given the number of highly skilled scientific people that we have in Greece? Why can Athens not be like a Cambridge, or like a Boston, or like an Israel, where it's known for its medical research? The next statement, fair and effective incentives for innovation. We can do much more to really create those. For example, we all know that we have a lot of rebates in this country for innovative medication. Why not have no rebates for 3 years, for example, for breakthrough innovation and immediate access to the market? That would really give the right signal to the international markets that we should invest in Greece. The second point is that intellectual property rights should always be respected. I know this is not easy when you're in so much pressure to create cost savings, but it always needs to be on the forefront of our minds. The situation we had last year or the year before, where we used data protection as a trigger for price reduction, cannot be accepted. Nor can it be accepted that the marketing authorization holder pays co-pay. That cannot be accepted as a principle, because what it does, it gives a signal to the international markets that Greece is not an attractive market to invest. There should be fair access to a quality healthcare system. We need to adopt a holistic view of the healthcare system. And it starts with assessing the medicines that we have. We cannot have a system where, on the one hand, we don't allow any new medicines onto the market for a couple of years, and then all of a sudden we say, okay, let everything onto the market, and there's nothing in between. We should really have a pragmatic way of assessing the technologies that we have. It should be based on a clinical benefit assessment, very much like the previous presentation also outlined, that informs the subsequent price negotiations that can take place between the government and the industry. There can then be fair negotiations and agreements between manufacturers and payers. But there should also be fair access in a sustainable way. We need to recognize that we do need to rationalize prescribing. We need measures that promote the right use of medicines and contribute to a sustainable healthcare system. Not every patient needs to have the gold standard. Uncontrolled prescribing of medicines is not sustainable. We all need to realize that. That's why we need to have rational volume control measures that are needed. And we also need to make sure that there are prescribing incentives and penalties to make sure that that is going to happen. And the other thing is that patients should be responsible also for their own medicinal consumption. Copay is a measure that could sensitize a patient, but our proposal would be that we need a blank sheet of paper and need to look at that again. If you look across Europe, there are many countries that have really thought this through as to how this can be done in a fair way and in a transparent way that is more equally shared across patients. We need to do that in Greece as well. So our suggestion would be to start that assessment. And last but not least, I started my story with that, the patient should be in the center. We know that every patient is different, and they should receive the appropriate treatment in consultation with their physician. We should adopt a science-based treatment guidelines and prescribing controls. We should also encourage the use of real-world data. There are many, many studies now and many, many initiatives that make use of real-world data to give information to policymakers as to how to use medicines in a way that the right patient gets treated and also costs can be saved. But a physician should always retain the ability to advocate for the right treatment through straightforward and transparent processes. Κλείνοντας, μπορούμε να πούμε ότι η εξασφάλιση ενός βιωσίμου κλάδου απαιτεί τη δυνατότητα προβλεψιμότητας, τη δημιουργία των συστών κοινότρων, ώστε να ενισχυθεί η καινοτομία και η επενδύση στη χώρα, αλλά και τη δημιουργία περισσότερων συνεργασιών μεταξύ του δημόσιου και του ιδιωτικού τομέα. Η δίκαιη πρόσβαση στις κατάλληλες θεραπείες και η χρήση των τελευταίων επιστημονικών μεθόδων με ένα ορθολογικό τρόπο εξασφάλιζουν τη βέλτιστη θεραπεία για τον κάθε ασθενή και οδηγούν σε μια πιο υγιή Ελλάδα. Ευχαριστώ πολύ.